Hi students, hope you all are doing well. So, welcome to another very exciting session of healthcare entrepreneurship. So, we are going to pick it up from where we left last time. So, let us get started. Biomaterials, biocompatible, biodegradable. These are three different terms. Biomaterial is typically any kind of material which goes inside your body and is trying to replace some kind of a tissue or a bone or a certain aspect and basically create certain functions which and improve the functions in a sense that you come to your original health. So, a lot of this biomaterial research is going on these days. One of the key aspects of this biomaterial is it should be biocompatible. So, if we look at this term bio and compatible, so bio is biology, compatible is are we compatible, that is the question. So, basically is an implant okay to go inside my body or a particular person's body and not reject my body? If my body starts to reject to that particular material, there will be an infection, inflammation, some kind of a bleeding and several other difficulties and challenges, right. So, the particular material biomaterial has to be biocompatible. Biodegradable, in certain cases it has to be degrading or absorbable or sometimes self healing in certain aspects. So, these biomaterials are sometimes used standalone and many a times used for majority of implants. For implants you can think of so many aspects. I will give you some examples as we go along. Okay, another thing, leveraging mobile device and embedded AI. This is a very interesting platform where you can use very simple AI based systems which are auto built within an app or generate new AI codes to do a very simple functioning which is currently not provided in the healthcare setup anywhere. One very key example is camera based analysis for digital dermatology. So, let us say you have some eruptions in the skin, some kind of skin tag, can you take a quick picture and this app will analyze through some kind of AI based platform and before data training where any kind of skin tags is kind of written as skin tags, anything which looks like a cancerous lesion can be told us that please see the doctor, this looks possibly cancerous, right. So, this saves a lot of time and you can do it on your own, saves a lot of anxiety where you can just be in your personal space and AI is already built into it. What AI does here is basically this compares with a lot of data sets which are available online or which are fed initially to train the system and basically tells based on that this is a possible case, right. Very interesting platform to look into as an entrepreneur. Another example is your everyday therapy kind of thing. So, somebody to talk to in an app. So, this is getting increasingly important. So, majority of the population not only in India worldwide is getting very lonely. If we look at, this is one of the shift which we are looking at with the 21st century. So, this lonely population, what is going on is we are getting into this mode of depression and some possible self harm, and there could be cases we feel like things are not going properly and we do not have anybody to talk to. So, looking at this mental health challenges, there are several conversational bots and apps which are built around it where somebody is in a person's voice can help you soothe yourself and give you some answers, like if you ask some questions based on some of your problems which you are facing on a day to day basis. Another example is whole patient trackers or multimodal approach. So, there are several trackers and this is quite widely popular. This opportunity window may have been missed like in the last 3-4 years if you are looking at this space, is where your whole body tracker, so this could have a watch along with it or several sensors where step count, how much you are sleeping, what is your activity on a day to day basis, how much you are eating, how much you are exercising, when are your medicines due, how is your overall kind of movement modality, are you falling down. So, everything is kind of whole patient tracker, as comprehensive as possible. This is another place in which the mobile devices are being leveraged along with the use of AI to get a lot of decent entrepreneurial opportunities. So, I would just like to take a step back as we have talked about the Indian scenario, what the difficulties and challenges are in the Indian market, and also have talked about some of the user personas in the telemedicine space and other spaces like in the healthcare domain, and we are also talking about some of the new products and services which are being offered. So, let us take a moment to distinguish between what we call as a product and what we call as a service, right. So, products are usually tangible. What does that term tangible mean? Tangible is something which I can touch and feel. So, if a watch is touch and feel, then I could call that watch as a product. If there is something which is intangible, I cannot touch and feel it, it is usually categorized as a service. This is the clear demarcation. More about products: we can sell, buy, store and transport products. When the sale is complete, we can move the product or even replace it for another product. However, we can define a service at a transaction does not involve transfer of physical goods from the seller to the buyer. It is basically a work that a person or persons do for another individual. So, that is usually what the service industry looks like. Products sold can be identical, but each delivery of a particular service is never exactly the same as the previous service, right. The services are difficult to identify because they are closely associated with a good, such as the combination of diagnosis with the administration of a medicine. So, services sometimes can be standalone, services sometimes are bundled with certain products, right. But products are very clearly not bundled with anything, they are very clear. Most of the times they are identical, like if you are looking at a pharmaceutical drug, it has to be totally identical. If the potencies change, then basically it is not serving the purpose. So, under the product, physical products usually come in many formulation. For example, clothes come in different styles, colors and sizes. So, these are your different brands for your pharmaceutical product. For example, also for your diagnostic products. So, you can buy a thermometer from Apollo, you can buy it from Modepan Labs, there are so many other providers, but it is all serving the same purpose, right. Services typically do not offer multiple formulations, as a doctor's visit is a doctor's visit, right. I cannot categorize a doctor's visit, I can categorize it as per speciality, but it is a doctor's visit. Now, either an Apollo app is providing that, or a Max Healthcare is providing that, or Fortis is providing that, that is a separate part, but it is still a doctor's visit, whether you are going for a tennis elbow or a diabetes. This is an example. Okay. So, unless a product has protection under a patent, it is likely that many versions of it exist. So, that is whenever we talk about products, intellectual property becomes important if you have a really innovative product. For example, consumers may have thousands of choices when they want a generic medicine or a regular device such as a thermometer. Very clear example, right. For service, companies that provide services may offer less variety depending on the type of service. For example, seeing a doctor typically includes the same elements. So, you are basically seeing the doctor, they will ask about your history and give some medication, whether you choose one provider or another. For products, customers can often return products and after purchase. These may allow them to more freedom while making their choices and purchases, as they know it is possible to reverse the decision. So, how often do we order from Amazon and return it, right? This is very common. So, very common with healthcare devices also this is happening, that there could be this possibly window of returning. However, service usually offers a satisfaction. Once a service has been provided, it cannot be returned. You can probably get a money back in certain cases where there is a negative experience or bad review, but it cannot be ideally returned, right. So, while forming a relationship with a customer for a product can help you market a product, marketing services often require a strong relationship between the customer and the business, right. So, marketing services need a stronger relationship, products are very clean and straightforward. So, let us take some quick examples of some products and then we will wrap up. So, some of the key medical product categories, the first one is diagnostic, so where we are looking at stethoscopes, spare parts of these stethoscopes, sphygmomanometers, diagnostic sets, otoscopes, ophthalmoscopes for the eye, pulse oximeter, fetal Doppler, ECG machine. These are some examples. Under medical products diagnostic, again we have the larger machines like MRI machine, smaller machine like spirometer, many of us have used it during COVID, X-ray machines. Under the medical products, the next type of products which you are looking at are implants. So, there could be so many implants from head to toe, typically made up of some biomaterials. An example here is the knee implant, and then there is a classic hip implant, which is basically due to severe cases of arthritis where there is a hip fracture, the hip implant is needed, right. Some other implants are spinal implants. When there is a there are diseases such as scoliosis, where a spine gets curved. There are other degenerative issues, like you have met with an accident and there is a spinal trauma. So, you need a spinal implant to put it back in shape. There are dental implants are widely used. Crown root implants, very often you may have seen somebody in your family, if you have not personally having a dental implant. Elbow implants sometimes during severe injuries, right. Then the third category is assistive devices and orthosis. So, here typically what we have is wheelchairs, walkers, assistive attachments. So, many of the folks without limb support, of if they have lost a limb, they would have an assistive attachment. Hearing aids, quite often used by elderly population who have hearing problems. Adaptive writing attachments basically. So, this is widely used for population who have some finger deformities. Many of the arthritic or rheumatic population has these kind of finger deformities, where then fingers are not rightly aligned to write with a pen or pencil. So, they need this kind of an adaptive writing attachment. Other examples are contracture braces. There are elbow splints and braces, finger and thumb splints and braces, and several other braces and splints which are used. Typically these are known as orthoses. So, the difference between a prosthetic and an orthotic kind of device is basically a prosthetic actually replaces a part of your body, and orthosis just adds on to your regular natural body which has got injured in some form, right. So, fracture splints and braces are not replacing your foot, it is just adding an extra attachment or aiding the better healing of your foot. So, these are known as orthoses. Some other devices are hip and thigh splints, knee braces and knee supports, pediatric orthotics for several pediatric population and diseases which require these kind of orthotic interventions due to long born or premature problem. Plantar fasciitis is a very common problem, which basically means foot pain of different modalities. So, this also has requirement of several splints and braces and sometimes insoles. Diabetic insoles very commonly used. A lot of diabetic population experience diabetic ulceration and possible neuropathy in their foot, like, so their diabetic insoles and diabetic shoes are provided which are soft and can properly cushion the foot. Diabetic walker boots, many of the diabetic population are not able to walk properly because of ulcers and blisters on their foot. So, orthopedic supports and braces are also widely used. Then under the wearables you have smart glasses, smart watches, glucometers, activity trackers, hydration monitors. So, many of the folks like in the athletic domain, like they are interested in knowing their hydration levels from a hour to hour or minute to minute. They would have hydration monitors which are again built out of electronic sensors, which are biochemical sensors which are trying to measure the hydration amount. Another set of devices, robotics, minimal invasive surgical robots and sometimes invasive surgical robots. So, many of the operations these days in the hospitals are getting replaced by robotic surgeries. Many a times you may have taken some of your family members for a surgery and may have heard the word or the sentences where a doctor has given you an option of either going for a regular surgery or going for a robotic version. Majorly happens with classic cataract surgery, which is cataract in your eye. So, these kind of surgeries are slowly getting replaced by very sophisticated surgical robots. There are neurosurgical robots which can work on your brain, like, and work with this cerebral arteries, right, very thin cerebral arteries. So, very sophisticated robots. There are robotic arms for doing a lot of activities like and surgeries, as well as there are behavioral therapy robots. So, this is a very interesting aspect given the mental health condition and the loneliness of a lot of population, growing population in India. Behavioral therapy robots are getting more and more traction, where there could be a robot who would talk in different tones and they would talk about how is your day going, how are you feeling now. If you are not feeling very well, powered by AI, this can get some answers from Google which can say please listen to a song or watch this movie, you may feel much more better. So, these robots are getting more and more popular. Here there can be an entrepreneurial opportunity. The other one is the telemedicine. We have talked at length about telemedicine, which includes healthcare consultations, telenursing, telerehabilitation and remote monitoring. So, these are some aspects which are huge entrepreneurial opportunities, very untapped in India. Then we have app based, so majorly health, we were talking about healthcare products so far, and now let us talk about healthcare services. So, there are so many app based sickness predictors, fitness trackers, glucose trackers, medicine reminder apps. So, many of these you would notice would not act standalone. This have to be bundled with a product like a fitness watch or some kind of a sensor to actually provide these services, right. Then there are other services like online pharmacy, ambulance services, which is ambulance on call if there is an emergency, home sample collection for lab tests. These are already quite popular and cluttered spaces. Let us talk about a few real like examples, like before we wrap up the session. So, some real life examples are Johnson and Johnson. This is a huge company, quite well known for baby products, but they also make vaccines, ointments, daily use healthcare, cosmetics, disinfectants and several types of bioimplants. So, they are working on several of these healthcare products and services like domain. So, it is good to look at some of these examples to look at what they do, and this could also initiate a startup idea. Abbott looks at diagnostic devices, nutrition supplements, medical mechanical valves, implants, components such as pedicle screws, these are orthopedic screws, guide wires, etc., and also looking at real time glucometers. We would not usually know Abbott makes so many things, neuromodulation devices and medicines. So, these are the range of offerings this big company Abbott is quite well known this offers. So, if you are starting as a company, new company, you could either choose one or two of these particular details where you have an innovation or product or service which these people are offering, but you need to look at these companies what they are offering before you go live, right, or go for a customer discovery understanding. Many a times you would like to avoid all these products and go for a niche product. So, that is why it is good to know what is going out in the market, who are the key players and competitors. Medical, so Siemens Healthineers is another kind of new age company. They are majorly into the medical imaging, lab diagnostic and hospital IT solutions. So, they are trying to, so for a lot of you IT folks who are interested to get into the healthcare space, hospital IT solutions is they do a lot of training and other activities by Siemens Healthineers. So, maybe if you can offer it in a better sense, this can be an opportunity, right, with a better offering. Sun Pharma, quite widely known, they have a specialty generic over the counter active. So, they have APIs, which is active pharmaceutical ingredients. APIs are quite often used for the medical drugs which you take, antiretroviral medications and manufacturing experts. So, they are this drug manufacturing and pharmacy business, one of the key companies in that. There are several others. Tynor is another company which has orthosis, assistive devices, braces, injury mitigation wearables for fall and fall prevention, wound protectors. So, sometimes so that you do not get a scratch or the wound heals in the right way. Autobac is another example which is a leader in prosthesis, orthosis and wheelchairs. So, with all these examples, now hopefully we have understood what the Indian scenario of healthcare space is, where the opportunities are as a healthcare entrepreneur which we are trying to learn, and with a range of products and offerings, how they are categorized and where we can start thinking or putting our brain towards a possible product or a service. So, hopefully this has given an insight. With that, I think these are the last few examples to look at. These are some examples of the online pharmacy, telemedicine market, and that is all.